we'll be delving straight to the next panel session, which is the artificial intelligence in healthcare. So my first question goes to Mr. Atef. Artificial intelligence holds great potential in addressing healthcare disparities. How can AI technologies be harnessed to provide timely and accessible healthcare services in remote and undeserved areas of Africa?
Good afternoon, everyone.
Good afternoon.
Yeah. So just to begin, can you hear me? Yeah. AI has been in healthcare before now, in the last 3-4 years. So if we look at, I think up to 2019, about 43% of healthcare in the world has been already using AI. So what's happening currently is just, with the drive in AI and people having more access to AI. I think there's an increase in the way we're using AI, and particularly in healthcare, AI can definitely shorten the time for certain processes and certain diagnoses, and especially in settings where we are understaffed and people have very, very limited access to health professionals. And I think one example is I think AI is better at detecting skin cancer than any other professional. So definitely, thank you. Yeah, then definitely using AI in healthcare will assist in not only accessing healthcare in underserved areas, but accessing better healthcare and quality healthcare, especially in communities where we are understaffed.
Thank you very much, Mr. Atez. I'll go to you now, Engineer Kemisola. So my question is, healthcare infrastructure in rural areas often face challenges like limited resources and personnel. How can AI assist in optimizing resource allocation, improving diagnostic accuracy, and enhancing telemedicine services to bridge those gaps?
All right.
Do I repeat the question?
Oh, no, you don't need to repeat. You don't need to repeat it. It's very clear, and it's similar to what you asked the first speaker. You've mentioned it: lack of resources, lack of personnel, medical personnel, and that is why we are bringing in artificial intelligence to bring the gap. When we have less medical personnel in a clinic, for example, now in a clinic, AI is there to bridge, to help. I do say something. AI is a tool, It's a tool, not a person. So for the fact that it's a tool, it's there to assist you. It's there to assist human. So in a place where we have less resources or less personnel, the AI will be there to bring that gap, to assist them in running your process. In terms of diagnosis, like you mentioned, in terms of even treatment, telemedicine. So all this are where AI is bringing. You've already, the question you had already, speak for itself. Yeah.
Okay, thank you very much. Okay, I'll go back to Mr. Atef. It seems that a lot of people didn't get what you said because of the earlier issues with the... So could you just summarize briefly what you said?
Yeah, what I was trying to say is AI has been in our life, especially in healthcare, before now. As of 2019, more than 40% of the healthcare system has been using AI in one way or another. And with making it easier to access the tools of AI and making it available for everyone, the only way forward is using AI to support healthcare, especially in underserved communities where we have lack of human resources, lack of equipment, and a lot of cases that need attention. And one example I saw is that AI is better at detecting skin cancer than human diagnosis. So, and just to be specific, as my neighbor here mentioned, is that AI is a tool, and it works by learning, and you still need doctors, you still need the good doctors, you still need human knowledge to teach AI to do certain things. But yes, it does bridge the gap. in healthcare tremendously. I mean, we can see the effect of AI even on, even by us just using ChatGPT. You know, AI helps you to do anything almost now, and so you can imagine that you know what it could do on the healthcare system, where we are here at almost like you know running it at a bare minimum level. So I think there's a lot to bridge, and AI is only an advance to you know healthcare systems, especially in Nigeria and the continent.
Okay. Thank you very much. So, Mr. John, this question is for you. Sustainability is a key concern. No, I'll give you this question. Data is crucial for artificial-driven healthcare solutions. What strategies can be employed to ensure the ethical collection, management, and sharing of healthcare data in a way that benefits rural communities while protecting patient privacy?
Okay. Well, as a matter of fact, I want to really appreciate the Digital Africa for giving me this platform. I'm the CEO of QIT, Quantum Innovative Technologies, and as a matter of fact, this question that is being asked right now is what we are solving. In fact, the solution we've developed so far, known as the Quantum Doctor, we've considered all the factors down from the data collection factor, the problem we are facing in terms of data collection. You know, in Nigeria right now, we don't really have a social register. Like, if you look at your general hospitals, for instance, you go there, and then the first person that attends, after your registration at the OPD, the first person that attends to you wants to take your vital signs. The nurse wants to take your vital signs, and then they clip this machine to your hand, and then they put this temperature regulator, a monitoring system in your armpit, and after some times they come up with this data, and they tell you, okay, they don't even tell you, that is to be realistic, they don't even tell you, they simply write it down in the folder. They simply write it down in the folder, and then at the end of the day, they'll tell you, okay, you can go and wait for the next patient to come. Then after that, your folder is being submitted to the doctor. Those are the processes in our hospital at this moment. So there is serious waste of data in Nigeria. Now, when you return to that same hospital, let's say after a month or a couple of months, they cannot make a reference back to the correlation. Like, there is no correlation between the former data that was collected and the present data. So what happened between that time and this current time? So you see, a lot of things, like, we don't have a lot of insight right now in the country, like data-driven insight. So we need to begin to channel that. So at Quantum Innovative Technologies, we say, no, this is not really good. We waste a lot of data, and then AI needs data to thrive. So data collection, effective way to collect data, is by the use of technologies like embedded technology. So we combine the field of embedded technology and AI, known as embedded AI. It's a rising aspect of emerging technology, embedded intelligence. So the embedded systems now is laced around with sensors that can help to acquire this data. Now, rural undeserved communities are our target in this case here. Because in these rural communities, these people there, they are not even educated. So that is one problem they are facing. They are not educated. Some cannot read and write, so they need a translation system. You get? So AI is playing a vital role there in the sense that this data collected can be harnessed and a storage platform created. So this data can be collected over time with timestamp attached to these things. And in terms of privacy, at Quantum Innovative Technology, we say no, instead of we taking charge of your data, because health data is very, very private. Yeah, I wouldn't want to, if I know about your health data, I may decide to do something like evil to you like that. So we decided to say, okay, let every user have independent management of their health data. So when I'm using the Quantum Doctor, for instance, my data, the data that is being collected from me is being streamed to my mobile app with the account I've created. So the healthcare data is being assigned to my account. Do you understand? Then another person that is using the same device can also stream his own peculiar data to his own platform. So over time, as you continue to use this device and acquire this health data, you generate what is known as historical health data, which is, let me say, which is what is also known as big data. So you can use this data now to train the machine learning algorithm through API access. So with this now, you can receive private data pertaining to you, peculiar to you. So you can know, for instance, now what we are delivering in quantum innovative technologies, we are telling you the exact time you're going to fall sick next. And then we are giving you medical recommendations that will help you to stay and prevent this from happening, so that you can save more money by less frequenting hospitals. We are not saying this is the end of hospitals. We are saying that what? You can take care of yourself to an extent. Then when you, something like emergency, like surgery and birth cases, you can go to hospitals for those kind of cases. So in terms of data privacy, I feel the best way to really manage data is personalized healthcare system. So the user should be able to take care of his own data. Because these hospital systems, right now, they are not really managing the data well as such right now. So I think it's best for the user to take care of his own data.
Thank you very much. I think you have more to say on this, that you can take care of yourself to an extent. We'll come back on to this. So we'll now go to our virtual panelists. Mrs. Olutola Vivian, can you confirm you can hear me?
Yes. Can you hear me?
Yes, we can hear you loud and clear. So my question is, cultural diversity and local practices play a significant role in healthcare decision making. How can AI-powered tools or AI-driven healthcare initiatives be culturally sensitive and adapt to the unique needs of rural communities across Africa? Do you want me to repeat the question?
Hi, can you hear me?
Yes, we can hear you now. Do you want me to repeat the question?
No, not really.
Okay, thank you.
So I think to ensure that the solutions we are creating, especially in Africa, is accessible to all, and we are imputing that element of diversity and inclusion. So I think the first thing we need to note is the quality of data. I think the previous speaker mentioned, data availability and all, because machine learning, precision medicine, AI, all of these tools actually require a training data set for which, the outcome variable is known, which is the disease or whatever it is you're trying to do. So, we need to ensure that the data we are getting are local data, so that whatever solution we are creating actually works for the target audience, right? So because, most of us, most of the tools and most of the softwares nowadays are like from outside of the country and outside of the continent. So it's very great if we can put in a proper structure to collect data, to acquire data, clean up data that are local, so that there is that element of, inclusion and representation, so that we can remove bias in our data, and at the end of the day, ensure that these solutions, these technologies we are developing, actually works for the target, audience. So I think the major thing for me is investing in data collection, adequate data collection, right? And ensure that AI solution in healthcare and all of these things, actually works for the right audience, and there is no bias, there is no misrepresentation in that aspect. And I believe it comes from we need to firstly think about how do we collect this data, right? So you mentioned one of the solutions that is already working on, which is a great one. Another thing I think we can do is to invest in digitizing healthcare processes, leveraging electronic medical records, electronic health records that can aggregate this data. Then we can then build AI on top of it. Because a lot of people, we are talking about AI, but we are forgetting that there will be a distribution problem along the way if we keep building all of these AI solutions. They need to be a distribution channel for the AI to work. So doctors, physicians, healthcare providers do not have the time to use different solutions. So I want to stay patient. I want to use an AI tool that does, how will I call it? that screens breast cancer. So I'll go download another app for that. I want to do the one for skin. I'll go download another app for that. I want to do the one for, different AI tools. Our doctors do not have the time. Our healthcare professionals do not have the time, and we don't even have the resources to build discrete systems. So I think aside from, in getting that data, we need to have that digital connected healthcare system, so that once we have that one place where we have our data, leveraging EMRs or in any other platforms, right, that we can aggregate the data, then the AI can then be implemented on top of that, and that can scale across, right? So I think for me, investing in efficient data collection processes and using localized data to train AI models or machine learning models will actually remove the bias and remove, misrepresentation, and to ensure that all of the solutions actually works for us here in Africa. Thank you.
Thank you very much. So our fifth or sixth panelist has joined us virtually. I earlier introduced her, but she wasn't around to acknowledge her presence. So I will just do a brief introduction of her for her to acknowledge. She is a medical doctor, researcher, and entrepreneur, the founder and managing director at Health IQ Consulting, and recently co-founded Matched Media, a health communications company. She received a medical degree from Medusa, an MBA from the Gordon Institute of Business Science. She's a final year Master of Science in Bioethics at Harvard Medical School. She has published and peer-reviewed various international and local journals. Her opinion pieces are published in South Africa and the US. She has a particular interest in self-care, social justice issues, innovation, and the intersection between humanity and technology. Please, let's welcome Dr. Brenda Kubeka. Can you confirm your...
Thank you. I'm here, and thank you for the introduction.
Okay, thank you. And I will just ask you your question. Are you ready?
Yes, I am.
Okay, you're welcome. So my question is, sustainability is... Just a moment before I proceed. Please, we're going to have more questions in this session. So just note your questions. After this question to Dr. Brenda, I would collect the questions so we can start responding to them. So Dr. Brenda, this is for you. Sustainability is a key concern. What models and funding mechanisms can support the long-term implementation and scalability of AI-driven healthcare solutions in rural Africa to ensure they benefit communities in the years to come? May I repeat the question?
No, I'm fine, thank you. I think I've got the question.
Thank you.
And yes, it actually links, I think, nicely to the previous question as well, that spoke to diversity, inclusion, and equity in healthcare. And firstly, I think what is important is that when we think of diversity and inclusion and AI, it's also important to make sure that the team that works around those solutions actually is representative of the various beneficiaries of that particular solution. Because sometimes we sit in our offices and we think that to understand what the end user actually needs to navigate the pathways that are supported by AI, but without them actually inputting and raising some of the questions that may hinder the success of the implementation. I think that is one thing that I just wanted to raise. So when it comes to sustainability, I think firstly in rural communities and underserved communities, if we look at AI and population health and what AI can actually bring with the understanding of various communities, including the ones that are mentioned here, there's so much value in AI and AI assisting policymakers to come up with decisions, to plan, with regards to various health services and solutions, because it's not just a biological abnormality that brings patients into the healthcare system. But 80% of healthcare actually takes place outside of the health system, which is the social determinants of health. So which means that the data needs to go beyond the blood pressure, the pulse, the temperature, etc. But where are the people living? How many are they in a room? If you get the TB patient and you already have the data and you know that there are 6 of them that are sharing the room, the system can be so proactive in diagnosing earlier or in coming up with interventions to actually enhance public health interventions. So that's one of the benefits. And then sustainability is around the skills that need to be invested in, and also how support in those rural areas and underserved areas. We know that there are challenges with human resources, retaining the human resources as well, but how does the support, that's offered by AI, which is human beings at the back, is sustained. So issues around people have the skills, people are retained, the succession planning, etc., is important. And then it's the ownership of the AI tools or AI solutions themselves, where if we don't own and we purchase in Africa, in South Africa, we do the same. We purchase solutions from other countries where you basically have no full control of who is the company going to be sold to, etc., etc. So those are some of the risks that we need to keep in mind. That should also fuel us to come up with locally grown AI solutions that we actually own, that speak to us and about us as well. Thank you.
Thank you very much, Dr. Brenda. Can you confirm if we have questions from the audience? If you have questions, you can just signify and someone will pick the question. You could note them for the sake of time. You've noted them? Okay, so they will pick it up. So before we get the question, Mr. Atif, this is for you. If you are to recommend a curriculum or undergraduates who are in school at the moment, how we can integrate AI in the healthcare sector, what would you advise an undergraduate to, what pathway would you forge for them?
So luckily now there's easy access to a lot of tools, a lot of online programs. So what I would suggest is, I think the problem we have is a lot of people that are undergraduates in healthcare specifically don't really focus on the information technology part of today. So what I would suggest is they start understanding how technology works and how, in particular, AI works. So this can aid them in the future, and to just open up their, I would say just open the scope more on what other tools and technology can help them. So I would definitely suggest they undergo any program that's related to information technology and AI, so they start understanding how things work and how things run at the back end. I think that will help them a lot to understand how they can build AI into their future, into their solutions if they're coming up with solutions, and into their day-to-day practice as well. Mm-hmm. So yeah, and I think that's vital in terms of their education.
Okay. Thank you very much.
Can you hear me? So can I add to that?
Yes, please.
All right, so I'd just like to quickly chip in that is one thing Digital Health Africa is currently focused on, because we believe that while the health technology space is rapidly evolving in Africa, we believe that the future stock is endangered, right? Because at the moment we do not have that in our curriculum, engraved in our curriculum, and you begin to see that consequence when you start, when you go to hospitals, clinics, and all of these healthcare organizations to introduce your solution, either your EMR or telemedicine. You see that there is that lack of literacy from the professionals, and they do not know how to use these digital tools. They do not have that digital health literacy. And you can trace that back to the kind of educational training they got even from their undergraduate days and all. So what we're trying to do at Digital Health Africa is to create a network, which is called Africa Digital Student Network. And this is for all students in the audience. You can check us out online. We have programs for you to equip you with the necessary skills, exposure, experience to be able to build that to build the interest to develop digital health solutions, not just as consumers, but also as innovators, right? So we have networks at the moment on 14 university campuses across Africa, where you can network with other students and learn about AI, blockchain, telemedicine, and whatever it is, so that as you become a professional or go into the space, you are more equipped to use digital health tools, you are more literate, you can even advocate for yourself. One of the speakers talked about health data, to know your rights, right? So these are all the kind of things that is possible. So you can just check us out. And we have a number of boot camps that we do in this line. Thank you.
Thank you very much. Do we have our questions? While we wait for the question, Mrs. Vivian, this is for you. Can you elaborate more on how AI play an important role in the health sector?
All right. So of course, AI has a lot of potentials, right? In terms of automation, in terms of supporting clinical decisions, and in terms of making, healthcare more accessible and more affordable. So we've seen a number of solutions, startups that are currently leveraging, artificial intelligence in the healthcare sector. We have Ubenwa, which is a startup that is using signal processing, machine learning to improve the diagnosis of birth, asphyxia in low resource settings. So the AI could detect why the baby is crying and all of those things. You can see Help Mom. Help Mom currently has this, chatbots that helps pregnant women and women who have small children with their vaccination, tracking, and all of those things. AI can also be used in your electronic medical records. So instead of your doctor typing over and over again, you have that automated process. And you also have the speech to text, where your doctor can just speak. Maybe you're trying to write the clinical documentation, so doctors can just speak and the system converts it to text. So that actually reduces the time that is being used to see patients, and that time can be now used for more discussion and to get to know more about the patient situation more, rather than doing clinical documentations. And it also takes away that cost of using paper-based healthcare processes as well. And as one of the speaker mentioned, in terms of detecting skin cancer, breast cancer, and all of those things. And also in terms of education, you can see that you can leverage AI. We have this, we have VR, AR that medical professionals now use to train themselves, and also in terms of therapeutic solutions as well. So there are a lot of potentials. There are a lot of importance of AI in healthcare. We just need to we need to get our infrastructure right, the basic infrastructure that we need to ensure that these things work well, these things are efficient in terms of electricity, proper data collection, internet, and all of those things. Get them right, because these are the things that actually powers all of this technology. Without all of these things, your AI exactly will be useless at the end of the day. So get our infrastructure right, educate our healthcare professionals to be better consumers of all of this technology, and ensure our data processes are very efficient, the data are well collected, no bias, and it is well represented of the target population, and it should be human-centered driven as well. So I think I don't know if I've answered your question.
Thank you very much. I'll ask Dr. Brenda this question. Dr. Brenda, can you confirm you can hear me?
Yes, I can.
Okay, so this is for you. Almost the same question as that of Mrs. Vivian, but yours is, Do you think AI can help provide permanent solutions to health-related challenges?
Okay, if you don't mind repeating, I'm not sure if you said permanent solutions.
Yeah, do you think, is an opinion, just your opinion, do you think AI can help provide permanent solutions to health-related challenges?
Okay. I think it can definitely offer opportunities, but to say permanent, I think we also need to take into account the context. I mean, as it is right now, in South Africa, we are experiencing, climate change challenges with flooding, et cetera, et cetera. So that's going to bring new challenges into the health environment, how diseases actually migrate, maybe new diseases that we have in outbreaks and pandemics that are coming through. So not so permanent, but definitely walking the path because, because things change, the environment change. If now we have high temperatures of, let's say, 60 degrees Celsius in South Africa that we're not used to. So there'll be, new challenges that are related to heat strokes that we're not used to. So I can't say permanent, but definitely walking, I think it's a platform and a solution that enables the health system to respond better.
Thank you very much, Dr. Brenda. So there's a question here. I'm going to throw it open. Anyone can respond. From Umar Abubakar.
Hi, Edith.
Hi.
Sorry, Joseph here. I just wanted to add something to the last point.
Okay, that's fine.
So one thing to keep in mind, in an AI project, the outcome is not deterministic. So it's not like you're programming a regular mobile application. There's a lot of randomization and probabilistic modeling that goes into the decision of an AI system. So in healthcare, there's no room for error, right? Because we're dealing with people's lives. And doctors don't like to believe that maybe the AI system knows better than all my years of medical school. So the AI system is affected by a lot of external factors, and the points that were made earlier about the quality and the relevance of the data also is really important, because that'll influence the outcome of the decision of an AI system in healthcare. So I just wanted to make that point that the outcome is not deterministic in an AI project. So we have to be very careful when we deploy such systems.
Okay, I have this question for you, Mr. Joseph.
Sure.
Okay, healthcare education is essential for preventive care. How can AI-powered tools and platforms be used to educate individuals in rural areas about health risk, disease prevention, and healthy lifestyle choices in a way that is accessible and engaging?
Yeah, great question. So with the rise of ChatGPT and all these generative AI models, the world now has a user interface for AI, and ChatGPT and these tools are almost like a power tool, not a hammer looking for a nail, but like a power tool. And just like in the past, we wouldn't say, okay, I'm not going to hire somebody that doesn't know how to use the internet. So it's the onus on the public to educate themselves on how to responsibly use these AI tools and platforms, because platforms like ChatGPT are a power tool. So it's a matter of that mass awareness, but everything with AI starts with education at the grassroots. So how do we build that next generation of AI talent? How do we start at the earliest levels with AI education, but AI education with merit? Content that's backed by some sort of government institution, something where there's confidence in the education system to learn about AI. And that can, just apply that to healthcare. So I don't know if I answered your question fully.
Yes, thank you very much, Mr. Joseph. So this is a question from Umar Abubakar. And he says, what are the ethical concerns associated with the use of AI in healthcare? What are the ethical concerns associated with the use of AI in healthcare? So it's an open question, so you can respond.
Okay, I'll start.
Yeah, I can go first. I mean, one of the major concerns would be the data privacy and the privacy of the population. And obviously, you know, if you don't have the right systems in place, the right policies, the right security measures, that's quite high risk of, you know, having someone's medical data released. Not only medical data. I mean, during, you know, with healthcare, you collect a lot of personal data as well. So, so there is that risk, you know, when it comes to the security of someone's private data.
Okay, thank you. Do you want to? Okay.
I want to add something to that. Another concern is accuracy. Accuracy, stemming from the second to the last person that spoke. Accuracy, you are dealing with human lives there. Accuracy is very important. So if you are going to leverage on AI, some of the concerns should be the cleanliness of the data, because AI systems work, the algorithms work based on the data you give to it. So when you give clean data to an AI, it gives you clean output. So if you are working, especially if you are introducing generative AI to augment, for data augmentation, because in most cases now, the data you are collecting is not sufficient to train the learning algorithm. So you may want to carry out what is known as data augmentation. So in that case now, okay, practitioners begin to think of active learning, which is like it's a branch of generative AI, whereby you generate synthetic data, and then these data are not real. You just want to simulate and add to what you have or currently on ground. So in that case now, we need to check the accuracy of these systems, because we will not be experimenting with people's lives. So I think accuracy is something to be considered.
Okay, thank you. Engineer Kemi?
Yeah, thank you. I think it all boils down to data, either data privacy and accuracy, which is accuracy is very, very important, which go back to the data, you know, you're using, because based on my area of expertise where I work, what I'm working on, I could see that accuracy is very important, because we're talking about human beings here, we're talking about health. So data collection is very, 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 very important. Like, no data, no AI. You can talk about AI without talking about data. And your data, the cleanness of the data determines the accuracy you're going to get in your AI or your ML. So, that is the major thing for me based on what I'm doing. The accuracy really, really, really is very important. Data privacy, really.
Okay. Thank you very much. Does anyone have anything to say? Mrs. Vivian, do you have anything?
All right. So I think for me, we should, aside from the data stuff, I think we should have policy in place, legal and policy frameworks in place that guides how we use AI in healthcare, as it is a very sensitive area, right? And I know, based on research, that some countries in Africa do not actually have a national digital policy or strategy that guides the implementation and monitoring of all of these digital health strategies. So I think our government needs to actually look into how to ensure that there is a policy, there's a framework that guides the use of AI in healthcare, so that we know who is responsible, right, for any adverse outcome that might result from the usage of AI in healthcare, which is highly likely considering how and where the AI might be applied or used. So I think there should be legal frameworks to guide what we do. Thank you.
Thank you very much. So the next question.
Yeah, if I may come through.
Okay.
Oh, thank you. Yes, I agree with the previous speakers and Vivian that we need legal and ethical standards to govern how AI from development to deployment and further monitoring and evaluation. The ethical issue that of concern is the bias or algorithmic bias that we need to ensure that it is reduced up to the point of elimination. All of us have biases, and if we think of machine learning using historical data, and that sort of health data has some sort of bias in it. So coming up with also systems of, how to identify the bias and having checkpoints, during when it's deployed, on ensuring that, that bias is reduced or eliminated. So issues of justice, where you may find that, AI can perpetuate inequalities that are pre-existing in the healthcare system. I mean, if you think of, I'll talk about South Africa, where to qualify for a kidney transplant, one of the criteria was the distance between a patient's home or place of work and a center that can actually, perform the surgery. But the reality is people don't choose where they are born and where they live. And if there's only 4 centers, let's say, in a country, then how can we use AI to enable, equitable access to some of these, critical resources? So the important thing is also ensuring that AI does less harm or no harm at all, but it's all about the standards and also about the mechanisms that are put in place to ensure that some of these issues that I've raised get picked up and continuously get reassessed, and adjustments are done accordingly.
Thank you very much. So we have another question.
I just wanted to add a point on the regulation side. So one thing we should be aware of is that regulation is slow and linear, but with AI, we face an exponential threat, and there's a shortage of independent experts. So folks that are building AI are not going to go and ask the government. Of course, in the US, Sam Altman and the rest, they'll go to the government and say, hey, come and regulate us. But the people building AI, are they asking for those guardrails in place? Are they acknowledging the risks? So where's the independent experts that are advising government? Because in the US, okay, there's federal agencies like the FDA, CDC that regulate healthcare, or the medical side. But even in the US, there isn't a sole agency responsible for regulating AI, because it's an interdisciplinary group of stakeholders. You have let's say the medical folks, you have the AI folks, and the rest of the stakeholders that are supposed to be at the table. So it's we're just at the early stages of that.
Okay.
If I may add to what, my apologies, Mr. Joseph has stated, I think the main thing is, who are the people that should be around the table to ensure that those guardrails, are in place? Obviously, the law moves slower than, what is available and coming out every day when it comes to, tech advancement. But there is a responsibility that the innovators and also the policymakers that sometimes have to adopt these tools, they also need to be empowered and have the confidence of asking the right questions and making the right decisions. So that's where independent, experts like ourselves, who specialize in healthcare ethics, they can come in and provide advice and stuff. Thank you.
Okay, thank you. So the next question is AI more objective or subjective than a human doctor? So this is an open question again, so anyone can respond.
I can start. I think AI is a machine, so it's definitely working with the data that it's given. So I would say it is objective, but to an extent, depending on the data that has been fed into the machine. So obviously, it does not have feelings, does not have any other things to be subjective. But if we must choose one, it's objective. But I think it also depends on who's using it and how they feed the data into it.
Okay. Thank you. Any other question to that? Any response?
Okay. To my own view, I think is subjective, because they cannot override us. The AI cannot override human. We are still the brain behind it. We are the one feeding whatever data is used. We are the one feeding the AI, the machine, the data. So I think they're subjective, and also the ability that we have that don't have it when it comes to critical thinking. I read an article on LinkedIn today about some jobs that AI cannot take, and it has to do with jobs with that requires critical thinking. You know, we're human. So the fact to remain that we're human, we're still the brain. We have the brain. Yeah, just the machine was cheap. But we have human, we have earth. We can feel, they can't. So I felt they are subjected to us.
Okay, thank you. Mr. John, do you have anything?
Okay, in my own opinion, I see it as both cases, some part subjective, some part objective, in the sense that as at now, we can say they are subjective in this time. In this time we are living in right now, they are subjective, in the sense that we still have controls over this AI. So they are being designed like the way embedded systems work, like assign the particular, this is your area, work on this area, and then give me, for instance, now we have ChatGPT, it's a text-based AI. It's a text. So when you ask ChatGPT to perform analysis in visual data, it will tell you this is not my specialty. So in that case, we can say that these AI systems are subjective. But in the next, for my thinking, in the next couple of years, like 5 years from now, we can talk about the objective aspect, whereby by that time, the generative AI must have gained a serious traction and a serious growth, especially in Africa. If we continue to invest, if the government comes into this scheme and invest more in this healthcare aspect of AI, I think the objective part of it, but it's not a call. It's not a call for fear. It's not a call for fear. Like I said, if we put accuracy as our watchword, meaning that all AI groups, all AI developers works alongside with medical researchers, I think we can achieve a balanced system and we can achieve what is known as sustainable AI. So if there is a collaboration between the practitioners in AI and the medical practitioners, we can strike this balance, whether objective or subjective.
Okay, thank you. Mr. Joseph, do you have anything to contribute to that?
No, I mean, I think it was Dr. Brenda earlier that said about the environment matters. So an AI has seen maybe 1 million patients' records, and a doctor who's trained maybe over years has seen 1,000 patients, but the context matters of treating that patient. A quick example, when I came from a trip from Nigeria years ago, I spent a week in the hospital in the US with all kinds of symptoms until a week later, they asked me, where have you been? And I said I was in Nigeria and they treated me for malaria. But if I had just gone to my pharmacist in Abuja, he would have just given me, Nivaquine to treat myself. So the context matters of where you're being treated and the patient's location.
Okay, thank you. Anyone wants to throw more light to that? Dr. Brenda, Mrs. Vivian? Okay, so let's just go to the last question we have for today. So this is not like a question. It says, my name is Celestine, and I work where this is more like a call to arms for all players in the health technology space. I would like to give this audience, I would like to give this person 1 minute to come up stage to explain what he means by this. So, Mr. Celestine, can you please join us? You have exactly 1 minute to do this. Thank you. He requested for that, so let's indulge him.
Thank you. Like I said, it's not a question. It's a call to support the 4-point agenda of the Federal Minister of Health. And the 4th point is a national EMRO program for the country. What that would entail is a platform where every EMRO system in the country can band together and build a national health information exchange platform. This national information health exchange platform would allow for data to feed from all over Nigeria to the center. If this is done, a bulk of the challenges in our health system, especially with data management that you spoke about, and then planning and research, will have been solved by 50%. And this will also allow other people, other investors can come into the health space and invest in the several sectors that we have to further make healthcare in Nigeria more robust. That is my contribution. Thank you very much.
Thank you very much. Would you have anything to say to that?
Yeah, because, sorry. Thank you for sharing that. I'm just sharing that for the first time. I don't know, maybe it has been, okay, it's 2 weeks, so there's no implementation yet. That's a very good one because I think that's one of the problems we're facing. Like I said, I work with data. My field, I work with diagnosis, so I do more of diagnostic devices, which have to do with data, collection of data to train the AI. I could tell you one of the projects we are working on, we moved to almost all the federal hospitals in Nigeria, just to collect data set for a woman with breast cancer, breast screening, not just general breast screening data set, but we couldn't find one. They keep telling us, no, it's not possible. We went to National Hospital, they said, okay, maybe you can drop a CD drive or any storage so that they can be storing for us. So they don't have anything, which is wrong. This is a nation. So I think that is a good step at a very good direction because we are in a digital age. We are in an age where data is really, really important. So thank you so much for sharing this information. Thank you.
Yeah, what I can add to that is we heard about it, especially that we work a lot with the federal government, with state governments on digitization and data. So it's a great initiative. It's this would definitely move the nation forward in not one step. I think multiple steps. But it also requires a lot of work from everyone. All of us, the government, NGOs, private sector. And the reason is that it is doable. If the banks can do it, the telecommunication sector can do it, there's no reason why the health sector cannot do it. So it's very similar approach, and I think when it comes to data exchange or centralized management system, no one does it better to the banks, and no one has more sensitive information than the banks, and they are able to sort it out. So there's no reason for us not to have this in the health sector, and this would not only make everyone's life better, it would make our work easier, when we have the data all in one place. Instead of spending a ton of resources collecting data, we still spend millions of naira just collecting data because, it's not available anywhere.
Thank you very much. Mr. John, do you have anything to say to that?
Nothing much. Just like I was about saying it before, that the Federal Ministry of Health, I don't know if you're a representative from Ministry of Health. Okay. So I think there's really this program needs to be reached out to them at the end of the program, like for especially this discussion in this health sector, because they are supposed to be players in this as well. I think that's what I have to say.
Thank you. Our virtual audience, do you have anything to add to that?
I think it's a great initiative, and issues around interoperability between the different service providers or different platforms. It's a great thing for a country to embark on, because at the end of population health issues, of data being available to serve the ministry or the country, and also its citizens as well. So I just want to commend your Ministry of Health for embarking on that. And also just on a cost perspective, with the reduction of duplicate testing and rework and losing files, etc., etc. There's so much cost that we sometimes not put a value to it. Thank you.
Thank you very much. Mr. Joseph?
Just a point, maybe something that the person mentioned was the data exchange. I think we missed that part of his comment. The data exchange is a concept that's been proven in the US. We've worked with one in one of the states in the US, and in the US they're able to do it at a state level rather than the federal. So depends on the regulation at different states, and the buy-in from is it the national hospitals, is it private clinics? So we have to keep that in mind, and also make the patient aware what that data, their healthcare data, what's that being used for. But the idea of a data exchange where developers can build on top of that data and have access to it, it's a proven concept. It would be great to see that executed.
Okay, thank you. Ms. Vivian, do you have anything? Mrs. Vivian?
No, not at all.
Okay,
Thank you.
you. So this brings us to the end of the session. However, before we leave, I would like you to just give a summary of how AI has improved access to quality healthcare in rural and undeserved communities in Africa. Engineer Kemi, I would like to start with you to just summarize how AI has improved access to quality healthcare, what the theme is about for this session.
Well, I would like to talk about myself, my own experience, my solution. And it's all about AI has made you have this carrying out your own diagnosing at the comfort of your own. That's the power of AI. And this is also helping the people, will help people in the rural community, underserved community, having themselves diagnosed without going for the big machines, without going to the big cities to get all those things done. And also assist the physicians, assist the physician in their own delivery. So I can say categorically that AI is really, really bridging that gap in diagnosing.
Thank you. Yes, the same thing, just a summary of
So, as I mentioned, I mean, it's a tool that's out there, and everyone's benefiting from it, and the health sector has been benefiting, maybe off the continent. So, again, it's time to catch up with everyone, and I think the tool is luckily this tool is available to everyone. So, we should just make sure we take this opportunity and move forward.
Okay, thank you, Mr. John.
Okay, I think what I would say is this, that the only real solution to rural areas health problem, health challenges is AI, because you cannot overemphasize the importance and application of AI in early disease detection, in drug discovery, in reaching out to these patients through technologies like telemedicine and AI platforms. So the challenges in the rural areas are very much, and with AI, we can really thrive better, especially in Nigeria and Africa.
Thank you very much. Mrs. Vivian?
Okay, so I think for my end, which is I work with HealthStack, which is a digital platform that digitizes healthcare processes. So I think for us, what we've seen so far is that AI helps with. It has really helped our customers or clients, which are healthcare professionals, to finish their notes 3 times faster with our speech-to-text recognition system, and to also support our to aid them in clinical decision support, right? So I think for me, that is like the evidence, the use case for me I've seen that has really worked. Yeah, thank you.
Thank you very much. Dr. Brenda?
Thank you. From my side, I think just one point to make with regards to AI and population health, again, is an ethicist that, it allows, professionals in the health system not to medicalize social issues, like, for example, patients with malnutrition, which is a symptom of what is happening in their environment, in the social space. So I'm looking forward to more benefits to be extracted from, AI to address disparities that currently exist.
Thank you very much. Mr. Joseph?
Yeah, thank you. So I always like to answer these type of questions in the context of an ecosystem. If I'm a stakeholder in Toronto, for example, where I did my AI master's degree, everything is done through an AI center of excellence, and every stakeholder in that ecosystem has a pathway to achieve their AI goal, whether I'm a doctor or I own a clinic or a hospital or an entrepreneur building in health tech. I need to have a pathway. So if you ask me this question in the context of a patient, let's say in a rural area of Sokoto State that doesn't have access, that just needs, maybe the hospital just needs electricity and water, or a fancy hospital in Victoria Island, they're in 2 different ecosystems. So how do we democratize access to AI to every patient so that they can all leverage this technology? And one thing to keep in mind, in healthcare, there's no room for error. So we always need to make sure that we involve the healthcare professionals and the ethicists that are along the way to make sure that the systems being deployed are giving the right results and for the benefit of the patient, because ultimately the patient, the doctors and the nurses, they're overworked and underpaid, and they can't serve all those patients. They also, the patients don't have access to the specialists. That's where AI, the power of AI can come in and democratize that knowledge and access to the patients in all areas. Thank you.
Thank you very much. Please, let's give our panelists another resounding applause. We would like to say thank you for joining us. It has been an intriguing session, and I'm very certain we've all learned one or two things. But one thing that we can't deny is the fact that AI has come to stay. However, it cannot override us yet. Thank you very much. Thank you. Let's take it.